Hello, my name is Rachel Briggs. I'm a student with Excelsior College, and this is my primary IV submission video. First, I would like to show you my setup. I have my MAR, my arm with the IV access, receptacle to when I'm priming the tubing, my normal saline, my all of the IV tubing, alcohol pads, hand sanitizer, sharps, clean gloves, everything that I need here. So let me get this set up here. So I'm going to knock on the door, wash my hands, and introduce myself and provide privacy. I'm going to go up to patient. Set this over here. There we go. Hi, Miss Larson. My name is Rachel. I'm going to be your nurse for the day, and I'm going to give you some IV fluid. So if you have any questions, please feel free to ask. I do want to verify, look at your name badge or your wristband and verify your name and date of birth. I've got my MAR here. So I've got Millie Larson, date of birth 1/1/1936, date of birth 1/1/1936, medical record number 123456, medical record number 123456. Do you have any allergies? So I'll make sure I check that. So then I've got my actual order here. I'd like to verbalize that it is 500 mLs of 0.9 normal saline at 125 mLs per hour. The drop factor is 10 drops per ml. So in doing my calculations, which I will be submitting, I did my calculations here, and I came up with 21 drops per minute, which would be approximately like a drop every 2.8 seconds. So I've got my supplies here. I am going to open up my normal saline. Let me move this stuff here. Okay. Expiration date, September of 2022. I'm going to label my normal saline here. I'm also going to double check with my MAR that it is 0.9 sodium chloride 500 ml bag. And on the MAR, it is 500 mLs of 0.9 normal saline. So this is the correct. So I'm going to label it with the name of the patient, the date, my initials, the rate, which would be 21 drops per minute, the infusion start time, and the infusion ending time. So I've got this labeled. I'm going to open up the port. Oh, Jesus, it came out on me. I want to be very careful not to touch anything here. This is also has an expiration date of 6/24 of 24. I also will be labeling this as well with my initials and the rate, date, time. This in here. Make sure it's clamped off. I also have my other tubing here, which I will make sure where, yeah, there you are. Sorry. Okay. Now I will hang the bag. I'm going to make sure that's clamped off. Okay. So I am going to do hand sanitizer again here. Again, I have my MAR with me here, and I'm just going to check the, make sure that I've I've got the right patient, everything. I did that, verbalized the order. I am going to prime the tubing. So I filled the chamber up halfway. And then I'm going to use my receptacle here. Oh my God, I can't even get it off. Okay, I'm being careful to use aseptic technique and not touch the port or anything. So then I'm going to unclamp this and prime the tubing, making sure there's no air bubbles. And just checking at each port part. There's a couple air bubbles there, that's good. No air bubbles. And it is coming through. I don't know if you can see it there, nice and smoothly. I'll reclamp it. So there are no air bubbles in the tubing at all. Then I will make sure that I label this as well. And then I'm going to use some hand sanitizer. My gloves on. Okay, so then got my clean gloves on. I'm gonna make one more last triple check here. Miss Larson, I'm just checking your IV site and I will look to see, palpate it, make sure that there's no signs and symptoms of infection. The tegaderm is in place. The insertion site looks well. There's no redness, drainage, swelling. It looks good. So then I've got this, yeah, you can see everything. I'm going to once again check 500.9 normal saline. I've got it labeled. I'm just double checking everything. Right patient, all the 5 rights of medication, and her wristband's right here, and I'm double checking that. So then I'm going to take and there's no air bubbles at all. Get my receptacle out of the way here. Then I'm going to get an alcohol pad here. And I'm going to clean the port. I'm going to insert this. Sorry, I'm so shaky. This is unlatched. And then now I'm going to take my watch and I'm going to count out 21 drops for a full minute, approximately 2.8 seconds. So this is unlatched. Okay, so I'm going to slowly get my watch situated here. One, hold on. Starting now. Six, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. So that's 21 drops per minute. Sorry, I didn't count the first 8 seconds out. I got a little nervous, but I do know that I have to count out loud and verbalizing that I was doing it at 21 drops a minute, so about 2.8 seconds. Sorry if I repeated myself a bunch. So there is that. I'll take off my gloves. And sanitizer. Gloves on. So sticky. It didn't say anything about flushes on the MAR, so of course I left that out. I just was real careful to follow what the specific MAR had stated. So now that it's done, I will, where's it at? Oh, there it is. So as if it's ran in the infused rate and such, then I would just disconnect. Use the alcohol pad. Still careful not to touch any of the tips of any of the ports. And then I'll make sure this is clamped. Check the IV site. Palpate it. Still looks good. There's no drainage, no leaking. Everything is intact. Tegaderm is in place. Has initial, the date. Everything looks good, and I'm going to make sure that she is in a comfortable position. I still will continue to make sure she has her privacy and that she's got her call light in reach. And okay, Miss Larson, thank you very much. Do you need anything? And just make sure she's good to go. And then I will go over to the MAR and I will sign the site, the flow rate, the IV site assessment, which I will do all that, and I will be uploading that video as well. Thank you.